It's 10 a.m. I'll call to order this special call meeting of the Public Safety Committee. Madam Clerk, if you would please call the roll.
Rick Brewer, Dawson Fields,
Here.
Michael Burrell, Raymond Jesse, Tom Kern,
Present.
John Metz,
Here.
Charles Thacker.
Here.
Mr. Chairman, you have 5 members present constituting a quorum.
I believe we've got Representative Hicks that will be attending. He's on his way back from Nashville. I have a brief statement I want to read, then we'll move into a motion for a consent agenda. I want to first welcome everyone that's here, citizens, officials, Hawkins County, Ballad Health, thank you for coming. Commissioner Alvis, last Friday, began making several phone calls to commissioners to bring awareness to the growing concerns in the community regarding the closure of the Level 1 Trauma Center in Holston Valley. I wish to thank Commissioner Alvis for being proactive and wishing to get the ball rolling on this topic. Representative Hicks and I have been in constant contact for several days. Representative Hicks continues to provide direct points of contact that help formulate a plan of attack and addressing as many concerns as possible. I've spoken with air and ground, EMS personnel, local education administrators, community college representatives, and others in an attempt to gather as much information as possible. Now, I know emotions are running very high on this particular issue, probably more so than many of the things that we've dealt with over the past 8 years since I've been involved. And, you know, that's rightfully so with the health and safety concerns that people in the community have. We as a collective community unit want to combat misinformation where it exists, obtain direct resources, collect pertinent information that benefits the citizens of Hawkins County, and work to provide a forum which allows all stakeholders to ask questions. This is a special call meeting solely for the purpose of gathering information to discuss 3 primary issues and to simply begin what will be a lengthy process with ample time for public involvement. As stated, this will be a 3-point discussion. Issue number 1, learn from Ballad about the closure of the Level 1 Trauma Center in Holston Valley. Issue 2, the potential effects on emergency services. Issue 3, bringing awareness to shortage of EMS personnel. And none of these above issues are to be settled today. So I would request that anyone who may wish to speak choose to do so at the public hearing. I anticipate the full commission may set a date for a hearing at the Monday night commission meeting. The mayor, the commission chair, and cumulative consensus of the county commission has been to ensure collective involvement on as many topics as possible. This is evident in the mission of creating subcommittees and public hearings when necessary. So with that being said, I'll entertain a motion for a consent agenda.
Make a motion.
We have a motion by Commissioner Fields and a second by Commissioner Burrell. All in favor, please move by saying aye.
Aye.
Motion passes. At this time, we'll move into our first issue of business, and I'll turn it over to the representatives from Ballad Health.
Commission, thank you very much. My name is Eric Deaton.
I'm the Senior Vice President for Market Operations, which means I get to work with all the hospitals across Ballad Health. Prior to my work with Ballad, I was the Chief Operating Officer of Hawkins Health System. So I had a great pleasure to work closely with Regina Day and the folks here at the Hawkins County Hospital, and really enjoy the continued work that we do here in Hawkins County. Really look forward to sharing with you information about what's happening here within Kingsort, within the Tri-Cities regarding trauma. And we also want to share some things with you at some point that's okay about NICU, about mental intensive care unit, if that's permissible today as well. We would say that Ballad Health came together about 10 months ago now. And that was the merger between Wellmont Health System and Access Health Alliance. And our goal behind that was really by working together versus working against each other, by wasting resources, by competing with each other. We can put those resources back into our community where it really makes sense to improve the health, not only of the Tri-Cities, but also the entire region. And so I think the things we're doing today really is advancing health care. Can you all see the PowerPoint? Okay, very good. Making a system-wide improvements is really the key to what we're hoping to do. And there are a number of things we're working on, and not only just with trauma and with NICU, but we're looking at other opportunities to expand population health. How do we really work on making our communities healthier than they are today?
Yeah, that don't look good.
This system-wide improvement of care really is designed to work in collaboration with our physicians, with the other experts in the field, and really thinking forward, how can we be different? How can we really improve health across our region? The intention really is to expand new services and really focus on coordination of care across the region. I think when you hear the plan for trauma, you'll understand that this really does expand access in many ways. It really helps support not only our 3 trauma centers that will remain open, by the way, but also all the emergency departments that we have across the region. And one thing just to be really, I'll be very clear about is that this is not something that we're flipping the switch on tomorrow. We didn't make an announcement I think about a week ago. These changes don't take place next week, but our plan has always been to take the next 10 to 12 months, really focus on, as we look at the changes that our board has approved for us to move forward on, how do we work with physicians, how do we work with local hospitals, how do we work with communities, how do we work with local EMS to make sure that we're all on the same page, we're all working together to really make sure the patient gets to the right place at the right time. Every time. Sometimes today, a patient may go to one hospital and be transferred somewhere else. Our goal really is that the patient gets to the primary hospital they need to get to for the best care on the very first time. So, in fulfilling this promise, we really do want to focus on making healthcare more accessible to everyone. We want to improve outcomes, and some of the things I'll talk about today with trauma. It does improve outcomes by centralizing certain very high levels of trauma, and then we think that we can improve and save lives by doing that. There are two primary areas to focus on today. One is launching and creating a comprehensive regional trauma system. In the past, we've had 2 organizations that did not work together comprehensively or did not coordinate care among the 2 hospitals, or among the 20 hospitals that were out there. Not only that, but we've had 3 trauma centers in this area. There are 13 across the whole state of Tennessee. We've had more high-end trauma supported here than anywhere else in the state of Tennessee. Nashville has 1 level 1 trauma center. Chattanooga has 1. Knoxville has 1. Memphis has 1. And many of those areas serve a very wide range of population. We have 2 trauma centers within 20 miles of each other, spreading resources, and serving a much smaller population of people in the region. So launching a comprehensive regional trauma centering system is really important to us. Our vision really is to save lives and improve quality of life. We want to integrate care among the facilities. We really want to focus our efforts on a location where we can have our highly skilled trauma experts really focusing on the very, very high-end levels of trauma care. And also, it's very important for us that we are coordinating this through a common call center and working with our EMS systems make sure they get to the right place. One person I want to introduce you to make a few remarks is Dr. Miles Testman. I know many of you probably know Dr. Testman. He's from Rogersville. He's been one of our trauma surgeons that's been at Holston Valley Medical Center for a number of years. He actually, people say he's the grandfather of trauma. I think he prefers the father of trauma, but he has actually helped lead trauma services across this region. He really was on the forefront of really helping start that in Kingsort. Dr. Testman's role going forward is he is going to be the Vice President of Trauma and Emergency Services across Ballad Health. So he'll be the person, and I'll be supporting him in leading trauma systems and creating our new trauma centers. So I'd like to introduce Dr. Testman to say a few words at this time.
Yeah. Thanks, Eric. I'm Miles Testman, Dr. Testman. I know a lot of you folks. I grew up here in Rogersville. Some of you may have known my dad. He had the Ford place, Testman Motor Company, and he told me not to go into the car business. So, and like Eric says, I've been physician in this area for over 30 years. I did practice medicine at the Rogersville Hospital here for the first 4 or 5 years of my career, and then moved to Kingsort. So I think I know the area and kind of the feel for the people here in Hawkins County. My mother is still living on East Main Street. She's 90 years old, and she could have a fall and get hurt and may need trauma services. So I think that's close to my heart. And like Eric says, I've been a participant and a provider for the trauma center at Kingsort since it started in 1988. I've known all the trauma people there since then. I've seen almost all the patients, which are many thousands of patients that have come through there in the last 25 years. As Eric says, one thing that is unique about our Tri-Cities area, I think we have a luxury of having, if you want to say a luxury of having 3 trauma centers in our Tri-Cities area. One at Bristol, one at Kingsort, and one at Johnson City. And I've heard many times over the years, why do we need 3 trauma centers? But actually, each of those trauma centers was very strong, did a great job, and I think did an excellent service to all the people in East Tennessee and all the people who were traveling through our area who were involved in accidents. Not only trauma, but emergency general surgery is another thing that trauma surgeons do now. So we're there, 24/7 in the hospital doing trauma and general surgery. Over the years, it's been somewhat difficult to fully staff our level 1 trauma center. And I don't know if some of you may work in a hospital environment, most of you don't. A trauma center has to have a lot of specialists, subspecialists to just be on call. Not the main trauma providers are neurosurgeons, orthopedic surgeons, and trauma surgeons. Trauma surgeons are basically general surgeons who specialize in trauma and critical care. We also have to have doctors who take care of eye injuries, ophthalmologists. They have to be on call every day and every night. We have to have urologists. There's some trauma that involves the urological system that we have to be ready for. Face, plastic surgery, different radiologists. Now in modern trauma care, we have to have interventional radiologists, and these are radiologists who do specialized investigations such as angiography and angiographic embolizations of injuries to the liver, the spleen, and they have to be ready on a moment's notice to help us take care of our patients. If we don't have these specialists available 24/7 on a yearly basis or bi-yearly basis, we're inspected by the state trauma health department to see if we're in full compliance with all our jobs at the trauma center, and we get docked on some of these deficiencies, and all the trauma centers in East Tennessee have to have all these services 24/7. It's very hard to do that, and so forth. So that's just on the trauma side of it. I think for the, and I would call it Hawkins County, Hancock County, in some ways even Sullivan County, rural trauma centers. We're not like Chattanooga, Nashville, and Memphis with that density of population. But it still takes a while to get patients to the hospital, to trauma centers. Our EMS folks do a great job. Here in Hawkins County, I'm actually the medical director of EMS and work with Jason here, who's an excellent EMS director. And I think the Hawkins County Commission does a great job supporting EMS and EMS services here. When the announcement for consolidation of our trauma centers was made recently, a lot of questions are going to be asked, and it's going to be a process to fully implement what we call one trauma center, which will be in Johnson City. And I do want to try to allay maybe some anxieties about the trauma center situation at Kingsort. We're going to have a trauma center there with pretty much full services. By that I mean we're going to have neurosurgery, orthopedic surgery, general surgeons and trauma centers doing trauma like we did before. When it's fully implemented, only the sickest and most severely injured patients would be taken to Johnson City. That type of patient would be somebody who's in a very severe car accident, somebody who's unconscious, maybe has to be on a ventilator, maybe has a brain injury, multiple fractures, somebody who's in danger of actually dying within an hour. And in the trauma world, we have a term called the golden hour. And so by the golden hour, we say that somebody who hasn't been killed instantly, and that's a terrible thing to think about, but within that hour, we have a chance to save that person's life if we get them to definitive care. And that would be at a trauma center. We're still going to have that capability for the golden hour, and I think once we go to one trauma center at Johnson City, at the Johnson City Medical Center, we're actually going to be stronger, and the patients are going to be safer and get better care through consolidation, more expertise available than we had before. And other questions are going to be asked, how is it going to take longer to get somebody from Hawkins County to the trauma center in Johnson City? I don't think so, and I'm almost certain that we can get our patients up there within that hour. Ambulances go faster than cars. It's not like just driving to Johnson City. So the patients in Hawkins County are going to be well taken care of with regard to trauma once this process is implemented. And it's going to take us several months, maybe a year, to get this process completed and in full force. We're going to be working with all the EMS organizations to put this together. We want to work with all the governmental entities. We want to work with Tennessee EMS, which is already in favor of our recent decision and so forth. So I'm optimistic about it. I think I have a personal stake in it because I'm from Hawkins County. I have a feeling for Hawkins County, and I'm optimistic, and I think that things are going to work out, and I look forward to getting this process going. This subject is very complex. I think I could stand here and talk to you all day about a lot of things about trauma, but I think that the main points that I want to get across is that we're working with you. The citizens of Hawkins County and the patients are what is more important to us than anything. This is not a financial decision. It's a decision that is going to be for the betterment and safety of all the people in Hawkins County, all the people who are traveling through Hawkins County. And I think that it's going to be a great thing once it's fully implemented and completed. So I know that's a lot to think about. Didn't want to talk too much, but I'd be very happy to try to answer any questions related to the trauma center or Hawkins County EMS or anything else. So.
Let me say a few more things, or did you want to? Yes, sir. Thank you, Dr. Tessman. I wanted to kind of share with you the elements around our trauma system across the region going forward. First, you start kind of clockwise there around 11 o'clock, where the 3 trauma centers will still be in existence. I think people said that we're closing a trauma center in Kingsort. We're not closing any of our trauma centers. All 3 will still be open. There are 3 levels of trauma designated and certified trauma centers in the state of Tennessee, a level 1, 2, and 3. And for the reasons that Dr. Tessman said, we will keep level 3 at Kingsort and at Bristol, because there are some specialties that we are unable to have 24/7, 365 days of the year. And those are specialties like urology, like sometimes plastic surgery, that we can't have at all 3 facilities 24/7. They are rarely called in for traumas, but in order to be certified or designated as a level 1 or 2 trauma center, you have to have those immediately available 24/7. So that's why when people talk about the levels, it's a little bit misleading, because don't look at the levels, look at what's actually the availability of specialists. And when you look at that, the availability of specialists, we're going to have, if you look at the traumas that we have in this region, at Holston Valley and at Bristol, we will continue to be able to care for about 85 to 90% of the traumas that we see today. Most of those traumas are related to orthopedic surgery, neurosurgery, general surgery. That's most of the trauma we see in our region. So we'll continue to have the 3 trauma centers. We're going to be developing a pediatric trauma center. So we're a region with 3 trauma centers without a pediatric trauma center in our region to take care of very vulnerable children. Pediatric traumas are taken care of in our trauma centers today, but they are part of the adult population there. So we think it's very important, as part of NICE-WANDR, to actually develop a new pediatric trauma center. As part of that, we're going to be developing and recruiting new pediatric specialties. There's oftentimes that children have to leave our area and go to Knoxville and Virginia and places like that for care, because we have not consolidated that care in one location. And we can't recruit the specialists that we need to help support them. So creating and recruiting new pediatric specialties is a priority for us moving forward. We're developing, as part of this, a new pediatric ER in both in Kingsport and in Bristol. And when people say that we're saving a bunch of money by doing this, it's actually not true. We're actually spending a lot of money on capital investments in developing a new pediatric trauma center, by developing a pediatric ER in Kingsport and in Bristol that we don't have today. So those are resources and capital that we're putting back into our region. One thing that's going to be very important is the creation of a new medical call center. Today, calls kind of come in from different places. Wellmont and Mount Lakes have their own separate call centers. So our focus is to develop a call center working with local EMS and 911 to help work on making sure we're coordinating care in one location. So when a call comes in, we can look at all the bed availability, we can look at all the specialty availability across the system, and we can get the patient to the right place at the right time by looking at that in one centralized location. Our plan is to have a physician actually being a part of that call center, so that they can help us make split-second decisions at the time that transportation is being made and can help support EMS more efficiently. The last thing is, these are all connected. So we have 21 hospitals across the region. 20 of those hospitals have emergency departments. And so going forward, we'll have a connected emergency system across the entire region we have not had in the past. Let me just tell you a little bit about the trauma that we are seeing in the area. Again, we see a little over 5,000 trauma cases per year. That's just 10%. It's actually less than that. About 8% of those are what we call the very, as Dr. Tessman said, very high-end acute type trauma. Multiple type of injuries that happens to a patient. So that's about 400 and I think around 400, 500 or so cases each year around 400 that we see that are actually part of the very high-end trauma. Those need to be taken care of in one location, because when you have the high-end trauma, as Dr. Cuthbert said, you have to have all the specialists in one place to help take care of that patient. Interestingly, when you look at it, well, 65%, like I said earlier, are from orthopedics and 20% are neurosurgery. So 85% of the traumas, the total 5,000 traumas, are actually those two specialties. And we're going to continue to have those two specialties 24/7, 365 at Bristol and Kingsort at Holston Valley. So that means that the majority of the trauma that we see, we see going forward, we've actually be taken care of at the closest hospital, just like it is today. We'll have a much more coordinated system of care. I think it's really important for us to think about that, again, if those, go to the next one, the three primary specialties, so we'll still continue to do cardiac surgery. If you have a heart attack, as best thing is to do is go to your closest hospital. But we'll be doing cardiac surgery and all at Bristol and at Holston Valley, just like we do today. We probably have one of the best cardiac programs in the entire nation at Holston Valley. We're going to continue to support that and grow that. We're putting more capital into Holston Valley to grow our heart center and to replace cath labs, to put in new hybrid operating rooms, to enhance our cardiac care there. You can go to the next one. So recruiting specialists is key for us. As I said earlier, as Dr. Kessler said, state regulations require us to have all these specialties on call all the time. And it really is, when you're having to spend millions of dollars to keep all those physicians in one location, when they're rarely being called in, it doesn't make sense. And we consolidate that into one location and really help support a level 1 trauma center. A really interesting thing is that when you look at the types of if you look at the types of cases that we're seeing, the Center for Disease Control says that falls are the leading cause of injury and death among older Americans. One thing we didn't know when we started looking at the data across our region, 90% of that trauma is part of this population. So approximately half of the trauma patients that we see in our trauma centers are 65 or older. So that's about 2,500 or so. We're actually 65 or older, and 85% of those patients, of those 2,500, are due to falls, or trauma due to falls that happen with our elderly patients. So that is something, now we've uncovered that and we can start working on prevention. We can work with EMS on prevention. They can go into homes and help our elderly population make sure that it's a safer place for them to be living. So there's a great opportunity here for us to actually decrease the amount of trauma, especially with our elderly population that we have in this region. One thing that that Dr. Chessman said that we want to pursue is we want to be verified by the American College of Surgeons. Today, neither one of the two trauma centers are verified under that. That's the gold standard for trauma. And neither of our level 1 trauma centers have been verified because we even have specialty care to support that. We also haven't been doing all the research. In a level 1 trauma center, you're supposed to do research, and that hasn't been happening either. So by consolidating one level 1 and having 2 level 3s, which is more than any other population in Tennessee, if you look at the level 1 and level 3s that we have in this region, we'll have 25% of the trauma centers across the whole state of Tennessee within this region. So our goal really is to be verified by the ASC within the next 3 years. Dr. Bracken Burns, who is the lead trauma physician at Johnson City Medical Center, will be leading that. So this is a map just to share with you. This is what our trauma system looks like. Again, we have the 20 emergency departments that's still going to be open. We're not closing any emergency departments. We're not closing any trauma centers. We're actually supporting those with a more effective transportation and communication system. So if it's okay with you, Mr. Chairman, what I'd like to do is introduce Lisa Carter. She's with our Knoxville Children's Hospital to share some information about new intensive care.
Good morning. I appreciate the opportunity to be here today. I know that the 3 items that you brought forward did not include the neonatal intensive care, but we felt it was a great opportunity to share with you also what we're doing related to that service within the region. We've received a lot of questions about that service and what it looks like. So again, I appreciate the opportunity to be here this morning and to discuss that. I'm a nurse by background. I'm actually a neonatal intensive care nurse by background. So I've practiced in this arena for many years. It really is my passion because my last child was actually a NICU baby. So I absolutely understand the dynamics that it brings and the changes that families can go through during this time. And, you know, as we've talked about this, that really has been on the forefront of everything that we've discussed, making sure that we have adequate services for families, which we do today. How can we expand those if we need to? So just like Dr. Testerman was talking about, we'll take the next probably 6 to 8 months to really make sure we've fleshed out these decisions, to make sure that all the support services are there. Again, we think they're there, but certainly we will be looking at those more in depth as we move forward to actually absolutely ensure that those services are present at Niswonger Children's Hospital. So the crux of what we're doing right now is really assessing access to care. I actually met with the leaders within this market about a week or so ago, and we talked about the services that are available. And one of the gaps that we continue to see throughout our most rural areas are primary care services and obstetric services. And that's something moving forward that we will continue to frame up for our most rural areas, is how do we support those services. So just like we're doing with trauma, we're really developing a system of care for kids. And that really extends from, you know, this area of the state all the way up to Johnson County and then much further into Southwest Virginia. Children's services are a little bit different in that we also stretch over into Western North Carolina and into Southeastern Kentucky. So we serve really a 4-state area and a 29-county service area. So this really has afforded us the opportunity to look at those services region-wide and what they look at for kids. So again, building access for kids, Eric mentioned, also includes emergency services. We looked at all the data, and not surprising at all, Bristol and Kingsort see a large number of pediatric patients in their emergency department. As a pediatric nurse, I am very passionate about, you know, care that is received in adult areas is not the same as it is for kids. It's great care, but caring for children is very different. It involves a developmental component. It involves a cognitive component. You know, gone are the days where we can just hold kids down and do things. We have lasting effects into adulthood from practices that were done in childhood, and we really are framing a different level of service in these areas of what true pediatric services look like. So again, it's a great opportunity to do that. It's a way to have that specialized clinical support that's needed. We're already working with Bristol in that area and their existing providers to really frame up what that service looks like for that market, what additional resources that they need, and then obviously one area of that does include the trauma services and what that looks like. So it really is about better outcomes. It's about having the staff that are trained and specialized for pediatric care in those areas to support that volume. So I talked about the emergency services in particular. You know, there are 20,000 pediatric ER visits in Bristol and Kingsort. So that is a big piece of what we're doing. And that will in and of itself reduce travel time. One of the things we've already done, previously in the old Mountain State system ERs, we had telemedicine capabilities into Niswonger Children's Hospital. So if a child came into the ER, say in Norton, Virginia, they could link in through telemedicine into the pediatric ER in Johnson City. Really, that was for a twofold reason. Number one, we want to provide the care that is needed for the kids and get the expertise needed for the kids. But number two, we don't want families to have to travel to Johnson City unnecessarily. Community ERs get really, really antsy when they get kids that are sick in their ER, and the automatic tendency is just to ship them out. But that doesn't need to happen all the time. So through telemedicine, we can frame up those services and keep kids locally that they can take care of there in those local hospitals. So we will be using telemedicine. It's a great resource in areas that don't have adequate coverage. So that is a piece of the emergency service plan as well, is to frame up those telemedicine services so they can link in to those specialists at Nicewonder Children's Hospital to get just a consult. And it's better than a phone call. You can actually see the child and do an assessment on the child to give a better consult visit. So as far as neonatal intensive care services, we have spent a lot of time delving into what's currently available, what the current state is. You know, previously there was no sharing of data and sharing of information between the two health systems, so we really did not understand the level of service that was provided at each facility. Since that time, we really have looked at the level of service at Nicewonder Children's Hospital versus the level of service at Holston Valley. And we really have found stark differences between that level of service. The primary difference is in pediatric subspecialty availability. One of the most critical physicians needed in a very low birth weight, micro preemie, is pediatric surgery, and that specialty is not available at Holston Valley. It is available at Nicewonder Children's Hospital. So we really looked at the services across the gamut and what was provided at each center. And we also found stark differences in the volumes at both facilities. And here's where we get into some of the recommendations that are listed from the American Academy of Pediatrics. Really from the state of Tennessee as well, is developing regionalization guidelines for neonatal and obstetrical care and what that looks like. They have really recognized that when communities de-regionalize that, meaning they dilute the volume, it really does affect the services and the ability to provide those services. So that's what we've looked at into this decision as well. And again, just as Dr. Testerman talked about, recruiting and retaining those pediatric subspecialties is vital. Some of them are very, very difficult to recruit. That stems from the number of providers that are choosing to specialize in pediatric services. Probably understand the majority of the population those subspecialists will serve are Medicaid population, so the reimbursement is very different. So they choose not to go into those pediatric subspecialties, which decreases the numbers even more. So we're working really, really hard to stand up Nicewonder Children's Hospital as the hub of pediatric care so that we can recruit and retain those needed subspecialists in our area. One thing we also saw was that there was a pattern of transfer from Holston Valley to Knoxville or Nashville. And when you look at the NICU at East Tennessee Children's Hospital versus the NICU at Nicewonder Children's Hospital, it really, really is an apples to apples comparison. We have the same services for our NICU here as they do in Knoxville. So some of those transfers absolutely could have been avoided previously had we been working together on that service. I'm actually working with East Tennessee Children's Hospital also on coordinating the care. They want to see a more regional approach to care, so this has also afforded us an opportunity to reach out to them and figure out collectively how can we serve kids throughout the greater East Tennessee region and provide a better service level. So one of the things that I hear over and over and over as I'm out in communities, and especially talking with school officials, is the need to integrate some of our behavioral health services. So that's one of the things that we're also framing up as far as the pediatric emergency piece, and then also some of our work with the school systems. We're building a telemedicine service in collaboration with the schools so that we can take those mental health services directly into the school system. So that's been some exciting discussions that we've had over probably the past 3 months. We currently have telemedicine services. We have those here in Hawkins County in the school system, so we're working to elevate that service to provide a component of behavioral health to address those needs for children while they're in school as well. So here's just a list of some of the pediatric subspecialists that we'll be recruiting over the next 3 to 5 years. We have some of these currently in our region and working at Nicewonder Children's Hospitals, and again, the intent is to bring more on. One thing we hear continually is they obviously want a work-life balance just like the rest of us do, so bringing on partners is very important. And that takes volume. You have to have the volume to sustain 2 or 3 instead of just 1. No one wants to be the one solo provider in the community. So we're working to bring additional partners on. We currently have a gap in pediatric neurosurgery, so that's something we'll be actively recruiting. And one of the things that also we've committed to with the state is framing up a child abuse prevention program. That unfortunately is a very real issue in our region, and through this, the development of the trauma system, framing up those pediatric emergency departments, and then recruiting these subspecialty providers, we can really frame up what a child abuse treatment and prevention program looks like for this area. So that is a very critical component that we're looking at, and currently a very big gap in what we're able to do. So here again is just a slide that kind of explains the system and the commitments that we've made. We've committed to the pediatric emergency departments. We've committed to enhancing the level of care and service at Niswonger Children's Hospital. And then we've also committed to taking care out into the communities, especially rural communities where people can't travel, so that hopefully they can go to a local provider and we can provide telemedicine support for the services there.
Thanks, Lisa. We'll wrap this up, but just want to reiterate a few things here. One is we're not closing any emergency departments, so all the services we have for our emergency departments stay the same moving forward. We're not closing any of our trauma centers. And we feel like we really need to have a comprehensive system of trauma centers and emergency departments going forward. We think we can better align cardiac care, neurosurgical care, orthopedic care moving forward. And we are really excited about adding capacity in Kingsort and Bristol around pediatric emergency care especially. Well, 2 final things I'll mention is, one, these decisions have not been made in knee-jerk reaction. They haven't happened in the last couple of weeks, but they've been over a number of months, 7 to 8 months, matter of fact. We have an alignment committee of the board of directors of Ballad. The Ballad board of directors is made up of members across the entire region, and not only in Tennessee, but also in Virginia. So it's been very important, and they've studied this over and over again with a lot of data. The consultants we've hired to help us gather data and look at it a lot of different ways. So we think this is the right way to move forward. Our board supports it. They've done a great job of looking at this over and over again to ensure that. Also want you to know that I've had discussions with the State Director of Emergency Medicine, Donna Tidwell, and she is excited actually about the ability for us to work together across the region. Many parts of the state, there's competitive issues that take place where there are 2 trauma centers and they compete with each other, or hospital systems that compete with each other. By us all being together now, we have the ability to actually coordinate care. She said they cannot do that anywhere else in Tennessee, and they're excited about the opportunity for us to be able to do that here in our region. So with that, I'll end our presentation.
Thank you very much. Thank you for coming. Thank you for taking the time to make the presentation. One of the biggest issues that's going to face not only this committee but the commission as a whole is what Dr. Testament addressed about EMS service, and that in the past has been an area that has been strained. I think they're getting stronger, things that have improved there, but that is definitely a major area of concern. And we had the forethought, a year ago, I guess, and when that wheel tax situation occurred, that we set aside $10 out of that for the potential of what we thought could be a pending crisis. That's something that is going to have to come into play as well. This medical call center for EMS 911, do you have any time frame of when that will initiate?
So today they're in separate locations. They are starting to come together, but we want to bring in our air flight services into that also. So I think we'll be able to hopefully have that stood up by April or May. This is kind of our time frame to start having the call center totally consolidated. And you may want to ask our president to, anything he wants to about EMS support going forward, but one of the things you do want to do is meet with the EMS director here and look at any additional support we can provide for Ballad Health going forward and see what those needs might be. So that's one of the things that I know Dr. Tessner and I have talked about is how can we work locally to help provide additional support where those needs might be.
I'd like just to reiterate what Eric has said about the Hawkins County EMS on an actual personal incident that happened recently. There was a terrible car wreck up on the bypass up here just a few months ago, and I happened to be down here visiting my mother, and I went to the scene, and it was a terrible thing, but the Hawkins County EMS was there, the police, and was working with EMS, interested citizens came, and it was kind of quite an experience. It just reiterates that you do have outstanding EMS here in Hawkins County that are on call 24/7, ready to help with people's health problems and saving lives. So I would like to compliment Jason and all the work that Hawkins County EMS does for everybody in Hawkins County, and it's their job is not easy. Oftentimes they feel like they don't get a lot of thanks and so forth, and I think that they deserve a lot of respect. And so I'm looking forward to working with them more. I think that Ballad's going to give them a lot of technical support, educational support, and so forth. And so I'm optimistic about the whole thing.
Do any committee members have a specific question that you would like to ask or a statement that you'd like to make based on those two or three now with the NICU, those three particular issues? Be mindful, we will have a public forum. So there's no questions on.
John, I have a question. I've not got to talk to Jason, but, you know, and the EMS is one of my big concerns. You know, it's gonna traveling the additional miles, and I might be looking at it wrong, but I think that that's gonna put the EMS on the road longer, and maybe that's gonna put that ambulance out of service in case you have another call down here. So, you know, it's a possibility that, and like I say, I've not talked to Jason, that we would have to add he would have to add another ambulance. And that probably would not be the big problem. Staffing that ambulance is probably gonna be the biggest problem. And, you know, that's one of our concern and I think it'd be a concern of most everybody here as far as the EMS goes. But, you know, we need to work out some kind of solutions to that effect.
I can just say one thing about that's a great point. We agree that's part of the next 10 to 12 month process is how we work through those issues. One thing I will say is you look at the very high-end trauma we've been talking about, they would not go to Holston Valley, but would go to Johnson City. Last year, we had about 35 cases out of Hawkins County, out of those 5,000 that we see across the system that would be higher in trauma, that would be going to level 1 trauma center. Again, most of the trauma will be able to still be going to Holston Valley like it is, but you're exactly right. We've got to work together on helping support EMS to make sure that they are not strained beyond capacity, and also help recruit additional paramedics and EMS technicians. We're certainly open to doing that and want to do that moving forward.
We definitely know there's a lot going on behind the scenes. There's a lot of communication that's actually occurring that we are not privy to. And hopefully this part of this is bringing out that there is some action going on in the background. Is the EMA director here? Perhaps in the next public safety meeting, we may want to address talking with the EMA director about possibly formulating some form of task force to work with the Region 1 EMS Directors Association, and that there's so many entities involved in this. We just want to make sure we're gaining access to all those assets that are available to us, and that's one of the challenges. We do have access to so many assets, but if you don't know they're available, you're not going to utilize that information. So I don't want to put the EMA director on the spot, but if there's anything that he currently would like to add, he can do so, or prepare for the next meeting.
I'll just, withhold this time, we'll prepare for the next meeting. Thank you.
And of course, the final thing was addressing the potential shortage in EMS personnel. I know Water State has, I think, 9 enrolled. Northeast State maybe has 5, I think, possibly. So, and those individuals are in such high demand, they already have job offers. So we definitely, as a collective group, want to make the public aware that there is a need in that career field. I believe the Hawkins County school system has a healthy health program curriculum at the high schools, at least at the local high school that I'm aware of, and we certainly want Dr. Bailey involved in that process. Are there any final comments?
I have one, I guess. I guess it's involves transportation from Hawkins County, say Rogersville, maybe Hancock County, to Johnson City. But I saw that map, and I'm assuming that you all take people from Abington in that area that covers Southwest Virginia too.
Yes, sir. We have the air flight services all across. And let me just say one thing about the air flight going forward. We have 2 air flight services today. The service we're actually, and that has created some issues because we have 2 different services to do that. We do want to have 1 air flight service that we're in the process of working through. What we have asked that as we work on this is we will keep all the air flight stations open moving forward. And we're actually looking at adding additional aircraft that may have a little bit more capability than what we have today. One idea has been to have twin engine aircraft that has IFR capability so we can fly weather's an issue for us in this region, so we can always fly like we want to, but that's something we're looking at is expanding the aircraft services. We won't have all the stations that we have open, but we do have medical transport ground and air across the whole region moving forward. That will stay as is or enhanced.
Another question I had was, there's a trauma center at UT.
Yes, sir.
Is there one in Asheville?
No, sir. There's not a level 1 trauma center in Asheville, so we would service actually parts of North Carolina as well.
I'm just looking at it,
Yeah.
well, I guess defending well on Kingsort.
Well, I'll say if you look at the level 1 trauma centers and around our region, like I said, Atlanta has 1 level 1 trauma center. Charlotte has 1 level 1 trauma center, and most of the time, a level 1 trauma center again supports a very wide population of patients, and so we're very blessed in this area to have 3 trauma centers, 3 out of the 13 in the state of Tennessee.
I anticipate Monday night we may try and have a quick discussion about the potential time frame to establish a public forum. To prepare for such, how much time would you need?
Just let us know, we'll make it work.
Okay.
I'd like to know, as EMS Director Jason, you got any comments on this, or?
Well, there was a question about this by Commissioner Barrett. He requested some information that I had to actually look up. I understand the importance of not duplicating services in the region, and being able to consolidate services. But as far as Hawkins County, and that's all I can speak on, several areas of the county, it's gonna be well over an hour for us to be able to transport to Johnson City Med Center. That's in ideal weather. When it's ideal weather, then we're gonna be able to use flight service. But if it's a rainy day, foggy day, snowing, it's well over an hour to transport to Johnson City Med Center. With that being said, the increased mileage then reflects to their ambulance bill. You're looking anywhere between $200 to $300 more per bill that we have to take to Johnson City versus Holston Valley. And as we all know, Hawkins County is a poorer county. People struggle to pay their ambulance bills anyway, so we're increasing their bills for be transporting to Johnson City Med Center.
Have you started looking at a plan to help take care of when you're out of this county?
Well, through the state, we have interlocal agreements through the state. It's automatic. Just like Ranger County requests us to assist them, Green County requests us to assist them when they're busy. That could possibly increase that we're calling on other counties to assist us covering the county, just like we may be called to assist other counties as well.
Well, Mr. Chairman, I have one other question, for Eric. And I apologize, I was just a few minutes late, you may have done covered this, but why was Johnson City selected over Kingsport?
Great question. So kind of two primary reasons is, if you look at the amount of trauma that's being done today, more is being done at Johnson City. So that was one thing. We have had more consistent coverage of all the specialties there in the past. Probably the most important piece is that part of the Certificate of Public Advantage, the COPA, we are standing up a comprehensive pediatric center, which includes the development of the Pediatric Trauma Center. And so in order to have a pediatric trauma center, you do have to have the support of the adult trauma center adjacent to it, level 1. So we put it there, we want to put it there because it actually helps support the development of the pediatric trauma center that we're going to have in the region also. So those are the three primary reasons why it was chosen.
I have another question, Mr. Chairman. Yes. Has there been any input from Eastman, BAE, the industry we have people?
Yes, sir. We actually know the Chief Medical Officer of Eastman, and he was supportive of the plan. We had sat down with him beforehand and went through with him. He was supportive of what we're doing. And we were in constant contact with Eastman, obviously, because they're one of our larger employers. I've not met with BAE yet, but happy to do that.
Once again, thank you for your time. Thank you for everyone's attendance. This is not something that's going to be settled very quickly. This is going to be a process, and we're all going to collectively be involved in this. And once again, as I mentioned at the opening, extend my appreciation to Representative Hicks for his involvement. He's been receiving just as many phone calls, probably substantially more than the rest of us, and he has been heavily involved. If there's anything Representative Hicks would like to address before we close.
Well, first of all, again, thank you for allowing me to be here and sitting. This is very familiar territory to me, so thank you for allowing me to say just a word too. You know, one of the things that I have been worried about with even going all the way back to the merger, and of course when the merger first happened, I was sitting right here in the same place I am today as a county commissioner. And one of the things that we're concerned with, and I know that Ballad is concerned with, and we've already addressed this, is what I'm about is for Hawkins and Hancock counties are access to care. And so the logistics of making sure, as Commissioner Thacker's already mentioned, and some of the others have already mentioned about transporting folks from, from Mooresburg all the way up to Johnson City is there's no doubt about it, the access to care is getting a little further away. The efficiency is getting better. I agree. I think it's going to. But that is definitely a problem within the next, as you said, 10 months or so. That's going to have to be worked. It's going to have to be worked out. The logistics of that, the staffing of EMS, paramedics. That's also a major issue that also is going to have to be addressed. It's one thing to talk about it. We're going to have come up with a comprehensive plan. And so that's just some of the things that I'm concerned about, and I know that many folks are in our region, is making sure that it's about access to care at the end of the day. That's truly what it's about. And so again, I look forward to continuing the dialogue, continuing for solutions. That's what we're all about is coming up with solutions to make sure, and I keep harping on access to care, but that's what it's all about. And so we want to make sure that we're coming up with solutions to make sure that access to care is available for Hawkins County, because that's who I represent in Hancock County. And so that's my #1 priority, is making sure that those folks are being taken care of. And so again, I appreciate everyone being here, and thank you for the opportunity to speak.
As stated, this is just the first of many conversations. I entertain a motion to adjourn. Have a motion and a second. Any opposed, please state. Thank you very much.
Hey. Hey, John, would you care to be like a kind of a spokesman? Let me ask you a couple quick questions.
Sure he will.
Very basic. I mean, I know this, like you said, this is the beginning of a long conversation. Did what was said by Ballad today alleviate any of your concerns, or what are your main concerns?
My primary focus is response time, and that's been an issue that we've dealt with for several years. That was a contentious subject a few years ago. That's why we need to focus our efforts. We need to encourage Ballad to reconsider some of their plans. Yes, we need to speak to them, do all that we possibly can on behalf of the citizens of Hawkins County to do that. But ultimately, at the end of the day, if we put more resources trying to convince them to do something that they're going to decide and set in stone that they're going to do, I don't want to look back and say we had 8 months, 10 months to prepare for the transport of the patients and being able to do other auxiliary items that will help facilitate that. That's where I think we really need to.
I mean, what leverage does Hawkins County or Hancock County have to change their plans?
We have the resolution essentially is going to be the equivalent of saying,
Please.
Ballad,
Yeah.
we would respectfully request
Yes.
that you reconsider. And they can say, duly noted, thank you for allowing us opportunity to hear what you have to say.
Yeah.
Basically, by passing a resolution, that has no bearing except for just maybe a feel-good resolution for us to say, we're doing something. I don't want to just do a resolution. I want to get people involved in the weeds on these topics to make sure that.
Well, like you said, we have 8-10 months to prepare. What are some of the things that you think need to be done in the event that this goes through, which it all likelihood will?
I think we need to do a simulated task force to deal with the propensity of not having enough units, which I'm very confident.
You don't have enough now.
We go to level 0.
Yeah.
Now that happens everywhere.
Yeah.
That's just something that happens. But we need to monitor how often is that happening with this transition, how many more times does that potentially happen, how many units would be adequate to improve that, how much more personnel is going to be. Now, naturally, as Jason stated, the increase in mileage is also going to increase their opportunity revenues. So they're going to be able to possibly generate more revenue to help support that. But if you don't have access to personnel, then you can't afford robots to do that hands-on service. So that's another factor that we want to have to deal with. Just like they stated, Rogersville has 9 enrolled in their program. I think Hawkins has 5. And they're in such high demand, they've already got jobs. So naturally, supply and demand creates what your pay is, and I anticipate
It just kind of exacerbates what Hawkins County was dealing with already, which was a manpower shortage in the EMS department. So
that's something we need to have at the forefront of this discussion.
okay, all righty then. Well, we're off and running, I guess.
Yes, sir. This is just one of many to come.
Okay, all right. Thank you.
Thanks a lot.
Thank you.
Yeah, you did.
Was that one of the reasons why Rogersville City Insurance is